Okay, this exercise is horizontal shoulder abduction, basically meaning that we are looking at trying to open up the space between the humerus and the fossa, or the cup of the scapula, basically taking a forward shoulder position and trying to start to move it backwards. And so you're gonna find a doorway, you're gonna get one arm up underneath. On the back side, you wanna get the hand, forearm, and elbow resting against the door frame. And you're gonna slowly walk yourself forward to get a slight stretch, say about maybe like 20-30% sensation in through the joint here. So you should feel some pec, some of the upper part of the shoulder, and maybe a little bit down the bicep line. Okay. And we want to make sure that we're not arching our back to get into the space to try to get deeper, or retracting the scapula, rotating our whole body around to try to make this a bigger stretch. We want to be really isolated about this space and just focus right here on the humeral connection to the scapula itself. And so you're going to take a couple steps forward again just to readjust, and then slightly lean forward, applying a little bit of pressure. Maybe just a small bit of rotation in the opposite direction to find the stretch. From here, you're going to take big deep breaths, so about 6 to 8 big deep breaths, 5 seconds in, 5 seconds out, trying to get that nice belly to chest breath work and a full exhalation, feeling the diaphragm contract, feeling the side abs engage, feeling the ribs come down. So big breath in and out. Focusing on everything that's happening on this side. Breathe in, feel the expansion through the lungs. Feel how it opens the ribs and stretches that tissue out even more, and then exhale. Big breath. And out. Good. Maybe leaning in just a little more. Micro changes here in the space. Maybe just a little bit more rotation, finding just a little bit more stretch. Big breath in. And out. And in. And out. On this last breath, breathe in. On the exhale, very slowly start to push that hand, forearm, and elbow into the door frame, feeling this contraction here, starting with just 10% effort. Just feel this connection, feel it turn on, and then build to 20, to 30, to 40. Stopping there and holding that contraction, that intensity for 5, 4, 3, 2, 1. Ramping it down nice and slow. Build that control up and down. Really working on that neurological connection of control for the muscle tissue. Take a big deep breath in. And on that exhale, without moving anything but the arm, try to squeeze into the back of that shoulder, that posterior deltoid, that scapular tissue. Thinking about pulling, sliding that shoulder head back, trying to get just a little bit of space from the door frame. Squeezing for 5, 4, 3, 2, and leaning in just a hair to capture that space, relaxing any tension. May cramp a little, may feel a little uncomfortable, but just breathe. Get 2, 3 good deep breaths here. Keep breathing, one more. And on that exhale, relax. Sliding on down. So that's 1 rep. So based on your programming, you'll do however many reps and sets that are prescribed. So just follow that protocol.